Welcome, everyone. This is the first Health Educator Show brought to you by Kern Family Healthcare. So, my name is Carlos Bale. I'm a health educator at Kern Family Healthcare, and I'm here with my colleagues, Flor de Loyo, also a health educator, and Bernardo Ochoa, also called Bernie. That's what we call him here at work. So, once you get to know him, maybe you can call him Bernie. But for now, Bernardo. So anyways, we're all health educators, and this is the first time we're doing a show on Facebook. And the topic for today's show is going to be asthma triggers, how to manage asthma triggers, non-toxic cleaning, how to live a cleaner lifestyle. These are actually topics from our first asthma class in our asthma series. So we're going to go over some of those things, kind of touch on that. And then we're going to try to answer some of your questions as well that you posted on our Facebook page. So I'm going to let Flor take it from here as far as summarizing what we're going to cover in today's show.
Okay, so today we're going to talk about what is asthma, why it matters, common asthma triggers for our members, how to manage triggers in and around the home, and how to live that healthy air lifestyle. So we're going to start with Carlos. Can you summarize or define asthma for us?
So asthma is a chronic inflammatory condition of the airways. So that's when the airways are sensitive to certain types of allergens or triggers in the environment, and it can cause inflammation, mucus production, also tightening of the muscles. And that'll close the airways, which makes it hard for the lungs to for you to breathe in oxygen, and then so that means you get less oxygen into your blood and into your brain. And so it's a chronic disease, no cure for it, can run in your family. So it's something that affects a lot of people here in the community because of the bad air quality. So. And we're also going to talk a little bit about what are some of the common symptoms. So the common ones that we see as far as people that come to our classes are like coughing. It's usually a dry cough, tightening chest tightening, rapid breathing, lack of air, sometimes tightening of your neck muscles. So those are some of the things you'll notice when people have asthma symptoms or an asthma attack.
So some of our members have mentioned or experienced these symptoms, and they've shared these during the classes. But why is asthma so important?
Well, asthma affects a lot of people in Kern County. It affects about 24% of, as far as people who have been diagnosed with asthma, it's about 24% of the population of Kern County. And so if you think about it in terms of numbers, it's population here is close to 900,000. And so 24% of that, that's a lot of people. And then as far as the people who actually are currently have active asthma, that's actually 17%. So those are people who actually have had recent asthma symptoms or asthma attacks in the past 12 months. So it's definitely a big problem here in the community. As far as how it impacts, the rest of society, well, it costs a lot of money to manage asthma when it's out of control. Because people who have out of control asthma are more likely to go to the emergency room, urgent care, and use more costly healthcare services. So that costs more for taxpayers. It costs more for like health plans that pay for the healthcare coverage. It costs more money for employers because then workers, employees, they miss days of work due to out of control asthma when they're sick due to it. It also costs schools money. So schools, they lose funding whenever students are chronically absent. And it's going to cost families money when they, like I mentioned earlier, they have to miss days of work to take their kids, let's say, to the doctor's office or to the emergency room. So it's definitely something that has a big impact. And one thing I should mention is that a lot of people don't realize how bad their asthma is. A lot of people think they kind of live like it's normal to have out of control asthma. So that's one of the things we want to try to fix out in the community is we want to try to increase awareness of what's out of control asthma and give you some ideas, information about how to get it under control.
So then there's about 1 in 4 people in Kern County that have been diagnosed with asthma, and about every 1 in 5 has had an asthma episode in the last 12 months. Would you say? Okay.
Yeah.
So it's costing all of us when we have uncontrolled asthma. Bernie, can you tell us the different types of asthma?
So there's quite a few different types of asthma. You have nocturnal asthma, where it happens during your bedtime, and a lot of times it happens because you're sleeping with the enemy. So when you're sleeping with the enemy, we mean you're sleeping with the dust mites. Dust mites are they're a natural organism that basically eats all the dead skin cells inside your pillows, your blankets. So anything that's living and is eating, it usually has to use the restroom. So when it has using the restroom, you're basically breathing the fine dust of the dust mites. So that can cause a trigger. And then we have nighttime cold asthma, meaning that when you're outside and it gets pretty cold, your airway starts getting smaller and contracting because your body's doing its natural response to keep the body warm.
So there are quite a few allergies that can trigger asthma for people that have, I guess you would call it allergic asthma or allergy-induced asthma. So then the other one I heard was the nocturnal or nighttime asthma. And what was the other one? The other common one that comes up again?
Pets. So pets
Yeah.
comes up often, but a lot of times they always try to say it's the pet's hair, and it's not the pet's hair; it's actually the pet's skin. So the pet dander. And if you were taking a pluck of hair from a human or a pet, there's a little bulb at the end. Those bulbs at the end, when they fall into the ground, they break down. They create the skin cells. So when you're walking in carpet or you're walking on tile or flooring, it goes up in the air, and that's what goes into the airways of someone that has asthma. And then when that dust goes into their airways, that creates the asthma attack and creates a trigger.
Yeah, another type of asthma that I come across a lot in the classes that we offer out in the community is exercise-induced asthma. And that's one it's tough. I feel kind of bad for kids, well, anybody, adults too, because it does limit your quality of life if you don't learn how to deal with that type of exercise-induced asthma. So, so we do talk about in the classes how you can kind of deal with that. But maybe, for example, taking your rescue inhaler before you exercise. Of course, we always recommend that you talk to your doctor before changing the way you use your medication to manage your asthma. One thing I also emphasize is like for children or adults who work outside and get exposed to all sorts of things that might trigger asthma, like allergens, pollen, and dust, and whatnot, is to change your clothes before you go to sleep, or take a shower or bath or anything to kind of clean yourself and remove all the pollen. So that way you don't sleep with the enemy, like Bernie said. So that's how you can see different types of asthma are linked together. When you exercise outside, okay, you want to control your exercise-induced asthma, but you also want to try not to bring home the allergens, bring them into your bed and sleep with the enemies so you don't cause, nighttime asthma if you're prone to that. As far as your allergies, well, we have already talked about that. There's so many allergies, so it's really good to know your allergies. It's kind of like you talk about know your numbers for other health conditions. But know your allergies if that's one of the triggers for you.
Okay, so there's exercise-induced asthma, nighttime asthma, and then allergen-induced asthma. And they're all somewhat related. So if you're out exercising, you may pick up some of the allergens that you may bring into the home. And then if you don't change or shower before bed, then you'll be sleeping with those allergens. And then you'll be breathing in as well the fecal matter from the dust mites. So there's at least 3 main types of asthma.
Mm-hmm.
Okay. And so how can we manage those triggers?
So there's actually a lot of things you can do. A lot of our members don't realize that there's a lot of simple, low-cost things you can do to manage the triggers in your home, even around your house too. But it's always good to start with the things that you're most sensitive to. So let's say you're sensitive to dust mites. Make sure to wash your bed sheets at least once a week, hot water, and then dry it in hot air in a dryer. We don't recommend to hang your bed sheets out in the open air, especially when the air quality is bad, or when there's a lot of pollen or allergens out on the air, because then you're going to sleep with the enemy again. So all this talk about sleeping with the enemy, I don't know. It sounds like, we're going to talk about a movie or something. But anyways, mold in the bathroom, that's another one, or mold in humid areas. So let's say you see mold somewhere on your bathtub or on the bathtub walls or shower walls or something like that. You can use vinegar and baking soda. So we actually show you during our classes how to clean the mold that builds up in your bathroom or other humid areas. We usually talk about a two-step process. Like start with vinegar because it can clean the easier to remove stains. If the vinegar doesn't remove it, then you try baking soda. So like you can spray some vinegar on the mold and then scrub it with a towel or like a sponge or something like that. If you don't like the smell of vinegar, it's better to pour it onto a cloth or paper towel or sponge or some sort of cleaning material cloth. And you can also dilute the vinegar. You can use some lemon juice if you want. So there are ways to kind of deal with that if you're sensitive to the vinegar. Although it is considered non-toxic, but some people don't like the smell. And then when you're going to clean with baking soda, make sure to moisten the cloth or whatever you're using to scrub off the mold. And scrub it good. It takes a little more effort. It will take more effort than those harsh cleaning chemicals, but it'll be worth it. I mean, it's worth your effort to reduce your risk of having health problems due to those strong chemicals.
Okay. So the harsh chemicals, they're toxic?
Correct. So we, in our classes, is it still recording? Yeah. In our classes, we like to promote not using harsh chemicals because, one, they're expensive. And two, they're very harsh on our lungs. One wouldn't see sometimes using these chemicals as bad because they're designed to clean. But when we're actually using them at a high amount, we start smelling them, we start breathing them, and that can really affect our airways. So especially those bleach chemicals, it starts attaching to our airways, our lungs, and usually that can trigger a large asthma attack.
Okay. So that's non-toxic cleaning in the home. And we know we have really bad air here in the Central Valley. So do you guys have any healthy air lifestyle tips?
Well, I recommend to start with something simple that you can do. If you have children, no idling is recommended when you drop off your kids. So if you're driving, taking your kids in a car, and let's say it's warm or cold, we recommend not leaving your car to run the heater or AC because that can help pollute the air around schools. So definitely we recommend parking the car, turning the motor off, or trying to wait inside somewhere, maybe inside the school office, things like that. We also recommend checking the air quality. So you can go to valleyairdistrict.org to check the air quality. You can also go Google air quality in Bakersfield, let's say. There's a website called airnow.gov. That's another source. So there are other things. If you actually go to the valleyairdistrict.org website, they have a lot of information about ways to reduce air pollution. Let's say switching to clean up yard maintenance machines like lawnmowers, electric lawnmowers, trading in your car for a cleaner car. Also, maybe replacing your wood-burning fireplace with a gas. Okay. So there's actually a lot of programs out there.
So, so you said Valley Air District. That's a good. They have a good website we can share. So, so this is just our first show on Facebook, and we'd like for you to join us next time, where we can continue discussing about asthma and what to do. Okay, so we'll see you.
Take care.
Bye.